Hi, everybody. Welcome. It's 12 o'clock, the first Tuesday of the month. And you know what that means? BioBites time. Time for BioBites. So welcome to BioBites, everybody. I see some good familiar faces joining us again. That's great. So my name is Jessica Frank, and I'm the Biological Medicine Program Manager at the Marion Institute. I want to welcome everybody here to our BioBites. It's our monthly free virtual educational series. BioBites connects you with some of the foremost experts in alternative health, natural healing, and biological medicine today, speaking on key topics relating to wellness and empowered health. So first, just a couple reminders and housekeeping. Um, please keep the mics muted during the presentation. Although open up your chat function. I'd love to know where everybody is joining us from in the chat function, and you're welcome to use that throughout the program. There are two parts. The first part of the program is Dr. Elhamamsy's presentation on biological dentistry today. The second half is our Q&A portion, where he will answer questions that you ask in the chat. So if you feel inspired, something came up during his presentation, you can go ahead and drop that into the chat and we'll get to it in the second part of the presentation. Third, I'll announce that our next BioBites is taking place on Tuesday, April 2nd, again at 12 noon Eastern. And it is New Blood, a closer look at live blood cell analysis. And that will feature Viviani Lima from New Start NutriCenter, who is a certified nutritional microscopist, discussing this fascinating process. So mark your calendars for that. Make sure you get our emails, follow us on our social channels, and we'll also drop that link into the chat at some point during our presentation today, so you can go ahead and register for April's BioBites. We are going to record today. I mentioned that. So once we're done with the presentation, within about 24 hours, you'll receive a recording of today's presentation, an audio version of the recording, the PowerPoint slides, and transcript. So all kinds of cool resources that will await you in shortly after this program ends. Okay, today's topic, it's all about biological dentistry and how biological dentistry may differ from traditional dentistry and what it's all about. Here to break this down for us is Dr. Mohamed Elhamamsy. Dr. Elhamamsy believes in treating his patients as a whole and implementing healthy, sustainable practices to achieve the best possible outcomes. He practices at Well-Rooted Dentistry in Providence, Rhode Island, specializes in SMART, S-M-A-R-T, smart removal, and restorative dentistry. Dr. E graduated dental school in 2011 from Alexandria University, and following university, he went on to graduate with high honors from the Advanced Standing Program at Boston University's Henry M. Goldman School of Dental Medicine. Dr. Elhamamsy ranked third in his graduating class and was formally recognized by Omicron Kappa Upsilon National Dental Honor Society. So awesome. He also received his biological dentistry training at Swiss Dental Solutions Clinic in Switzerland. He skillfully eases any anxiety and apprehension to provide patients the dental care they truly need and deserve. Fun fact about Dr. E, he is proficient with the barbecue tools too. He loves to grill at home and often experiments with new recipes in the kitchen. So without further ado, please welcome Dr. E. I'm going to pass it over.
Yeah. Hello, everyone. Thank you for attending, and I will start sharing my screen. So I want to know if everybody can see my screen.
Looks good.
Right. So starting, my name is Mohamed Elhamamsy. I graduated, as Jessica mentioned, from Alexandria, Boston University. I'm a member of the IAOMT, which is International Academy of Oral Medicine and Doxology, as well as I'm a member of IABDM, which is International Academy of Biological Dentistry and Medicine. I have my training with Swiss Dental Solution in Switzerland, and I'm finishing now completing my training in the American College of Integrative Medicine and Dentistry to get my natural path degree, and it's going to be completed by October this year. So today's topics, we're going to go through all of these topics, and we're going to have enough time to have some questions as well. So what is biological dentistry? So biological dentistry, in general, we believe in these points here. So first one is mouth-body connection. We truly believe there is a connection between our teeth and the rest of their body. Because I used to hear that word even in my dental school or practices that I work. It's just a tooth. No matter what happened, it's just a tooth. So I really believe that tooth has a connection to the rest of our body, and we should take care of the rest of our body and the general health. So there is a mouth-body connection, and we're going to discuss a lot today. We focus mainly in the root cause of the disease instead of just treating symptoms. So this, instead of just treating symptoms, and we're going to have for every single patient like individual treatment plan. So we have two different patients. They have cavities. We treat that patient different from that patient. It depends on many factors, and we will discuss that today as well. So we use biocompatible material. So we don't use any material that has toxins or can harm your body, as well as we can remove the toxic material safely. For example, like amalgam, which is like a mercury fillings or silver filling. We will discuss that as well. And we use the advanced diagnostic tools, for example, like CBCT scan or cone beam. And we're going to talk a lot in every single point here in details. So mouth-body connections. So according to Dr. Steinman of Loma Linda University, he proved that every single tooth has like blood supply, has lymphatic supply, has innervation, and it's exactly like it's a living organ, and it's connected to the rest of our body. So according to Chinese medicine, every single tooth has a connection to an organ. So when I started doing like biological dentistry, I had a patient who was like suffering for migraines for years. And when she started coming to us, and I was like, okay, let's do the cone beam. And we found like an infected tooth. And we extracted this infected tooth. And since that day, she called at night. So to make sure to let us know that the migraine is gone, she doesn't have it anymore. So we really believe in every connection between the teeth and our body. So, and every single tooth connected to an organ as well. Oral microbiome. So microbiome refers to the microorganisms that share our bodies. And there is some studies says that number of microbiome or microbes present in our body is almost the same or even more than our own cells. So oral microbiome or oral microbiome balance really helps making us healthy. So we really take care of the oral microbiome because it's like our mouth is the mirror to our systemic health. So oral microorganism that it's in our mouth, if it's imbalanced, we're in healthy shape. If it's not imbalanced, that can go to the rest of our body through our blood vessels or GI tract and can cause further diseases or problems. For example, like recent studies showing correlation between oral microbiome imbalance and the increased risk for heart, pancreatic, and liver diseases as well. So every time I'm telling myself and tell my patients too, when you take care of your teeth or brushing your teeth or flossing your teeth, especially like floss because you're taking care of your heart. So every time I floss, I'm flossing for my heart instead of my teeth. Microbiome can be affected by diet, whatever we eat, and alcohol consumption, and can be affected by smoking, pregnancy, antibiotic, and dental products. Smoking increases the acidity of your saliva, facilitate the bacterial adhesion to the mucosal surface, and can impairs our body immunity. Alcohol leads to increase the gram-positive bacteria that can lead to dental cavities, antibiotic, and most of the mouthwashes destroys the good and bad bacteria. So we need a balance between good and bad bacteria. We focus a lot on nutrition in biological dentistry. So sugar, when I say sugar, like I mean sugar and carbs, fruits, honey as well. Sugar provides food for bacteria to thrive. The amount of sugar and the frequency is equally important. So it depends, like if you're eating like multiple times, exposing your teeth to sugar for lots of time, that's risk the same way as the amount of you eating. So we need to limit our intake for carbs, sugar, and as well like honey. If we will do it, just limit it for once a day. And if you can just swish after with some water, that will be great. There is alternative for sugar. It's called xylitol. Xylitol, like it's protective and decrease bacterial adhesion. Some people are a little sensitive, can cause bloating a little bit. So you must be careful with xylitol. So we're focused a lot on these vitamins, vitamin D and C and K2 and magnesium, which is what we call like the Fantastic Four. And like high levels of vitamin D have been correlation with improved overall periodontal, which is periodontal health, and also preventing cavities. So the more you're better shape in vitamin D, so the less cavities, the less gum disease, and vice versa. Sometimes we see patients who has like lots of cavities, which is especially kids, and we figure out where they are vitamin D deficiency as well. So cheese has some enzymes that found in cheese binds to the hydroxyapatite, which is the enamel component, and prevent adherence of the bacteria to our tooth. So I grew up when we eat like a piece of cheese after our own dessert, like, and lucky like the whole family and like everybody I know who does that never had a cavity. I never had a cavity because I think I'm doing that. So after dessert, we eat a piece of cheese. It's like Parmesan cheese. And we really recommend high fiber food, especially for children. It's important because the more they chew and the more they use their muscle, the better the jaw development. Again, just growth follow function. So if we chew and we use our muscle, the jaw will develop better. So it will be less crowding and actually improves the airway and improves their sleep as well. So therefore, we should stay away from providing only soft diet for kids like Gerber food, and we should support with like solid food as well when they are young to encourage like jaw development. Again, in the biological dentist, we focus a lot on the root cause. So it's important to treat the cause of the disease and not just the symptoms. For example, for like cavities, we can treat cavities by filling them, drilling and filling, drilling and filling. However, if we don't address the main problem, like diet, poor oral hygiene, acidic saliva, vitamin deficiency, like vitamin D, then we just being in a circle, keep doing whatever, like filling and drilling, and we get a new cavity. We just keep getting more cavities and more cavities. We individualize treatment plan as I mentioned. So every patient has unique medical history. Every patient has unique diet. Every patient has unique bite. So therefore, each treatment plan must tailor to the individual in order to optimize their oral and whole body health. Chronic diseases. Like the mouth can have lots of chronic diseases like dental infections, like periodontal disease, which is like the most recent study says it's around 65% of the population have periodontal disease, which is the gum and the bone that supports the tooth. It's inflamed. So periodontal disease is inflammation in the gum and the bone tissue that support the teeth. And it can affect your oral health. Like you will have something called deep pockets, you will have gum recession, tooth mobility, and finally tooth loss, and it can affect your systemic health. So periodontal disease inflammation has been linked to low-grade inflammation, in our body that leads to chronic diseases such as diabetes, obesity, and as well as cardiovascular and neurological diseases. So again, like maintaining good oral hygiene can really affect the rest of our body, maintaining the health of our oral cavity, really maintaining the rest of our body, especially our heart and neurological diseases. Health, I mean. Oral health and mental health. So there is lots of studies like says that poor oral health is strongly associated with fear and anxiety and shame. And in children, like untreated tooth decay can lead to school absence, learning deficiencies, and difficulty making friends. In 2016, in the Canadian Journal of Psychiatry, discussed the fact that many psychiatric disorders, such as like mental illness, eating disorder, are associated with dental diseases as well. We're talking about dental material, like difference between biological and traditional dentistry. So amalgam, it's that silver filling you can see in this picture. Amalgam is like 50% metal, 50% mercury, which is neurotoxin. And everybody knows how harmful it is. And not only will be harming your body because it's a heavy metal that has mercury, and as well you can see in this picture here, it's a metal, so it's not bonded to the walls of the tooth. So every time you eat on this tooth, you kind of wedging this metal, kind of creating this crack here. You can see this big crack, another one, small one, every time you eat it. As well as metal doesn't expand the same way like our teeth expand when we drink something hot or drink something cold, it wouldn't shrink. So we have leakage most of the time underneath them because it doesn't have the same property like our teeth. According to the FDA, some signs of excessive mercury in our body can be like mood disorders, like anxiety, depressions, and sleep troubles, fatigue, memory troubles, and like has been linked to Alzheimer's as well. Tremors, like shaking, difficulty with coordination, visual changes, and changes in hearing as well. And that picture we're seeing here, it's an actual text and logo from an amalgam label. So the box that comes has this dental material. It just has to have this warning sign. It says it's poison, corrosive, and it's 50% mercury. As you can see, 600 and 600. And it says here, warning, it's neurotoxin, so it can affect your brain. Nephrotoxic, which is going to affect your kidneys, can affect your lungs. It can cause pulmonary edema, and it can affect your vision, affect your, like, has like birth defects or reproductive harm. So in biological dentistry, we remove this toxic material safely, which is like called SMART protocol, and we follow the IAOMT guidelines for amalgam removal. So as you can see here in this picture, everybody is protected. So the patients almost covered head to toe. And you can see the nasal oxygen covering the nose, and the tooth we are working on isolated with a rubber dam. You can see here the high suction that will take all that vapor of the mercury out, as well as you can see, I'm not sure if you're able to see over there, that's the ionizer and the filtration system. And we follow like 5 days protocol detox. So it has glutathione, has vitamin C, lots of binders, lots of minerals as well to detox while we're doing that process. And instead of using silver fillings, which is sadly till this moment, most of the insurance covers only mercury fillings for back teeth, we use biocompatible restorative material, ceramic-based restorations. And it's aesthetic and doesn't have lots of these chemicals and PPA free. But again, it's important to have PPA free because to be PPA free, because PPA binds to the estrogen receptors and affect both body weight and tumor formation as well. Because like some white fillings, they have PPA, by the way. So I had lots of patients. Okay, I changed my mercury filling with another white filling. Okay, is the white filling is toxic the same way like the mercury is, or it's for sure it's PPA free, it doesn't have any of these chemicals as well. It's important. We use for crowns and as well onlays something. It's ceramic. It doesn't have like we don't use the metal anymore because the metal interfere with the electromagnetic field, which is like we're made from electric pulses back and forth from our brain to the rest of our body. So ceramic doesn't interfere with the electromagnetic field the same way like metal does. And as well as it's static and has similar properties to the naturality. Okay. Yeah, we use biocompatible material like ceramic implants. Ceramic implants doesn't corrode the same way like titanium implant does. And there is no pure 100% titanium implants. We call it titanium implants, but there is no pure 100% titanium implants. Most of them has nickel, most of them has aluminum. Like imagine we don't cook in aluminum pan or whatever, and it's like piece of metal inside our body. That metal corrodes over time. That metal interfere with the electromagnetic field, and like we lose bone around the metal implants more than ceramic implants because ceramic is inert, doesn't cause any inflammation around it, and what we call it's clean implants. And that has low inflammation due to tissue response to inert material. In biological dentistry, we use ozone therapy, which is like anti-inflammatory, antibacterial, anti-parasite, antifungal. And the good thing about ozone, it does target the bad bacteria. It doesn't kill everything. And another thing, like one molecule of ozone will kill the same number of bacteria as like 3,000 to 10,000 molecules of chlorine will. And even like almost around 4,000 times faster than chlorine. Right? Airway, which is a big topic. As you can see here, in biological dentists or holistic dentistry, because we look at the whole body, evaluating the airway is a must. So we use the cone beam. It's called CPCT scan. The device goes around your head, which is evaluating your sinuses, evaluating if any hidden infection, evaluating of the airway as well, if you have a narrow airway. Because having narrow airway leads to higher risk of sleep apnea. That means oxygen deficiency at night. So every single night we sleep, we have a narrow airway that can lead to oxygen deficiency, that which every single organ needs at night, which is the oxygen. And we're not getting enough sleep too. Sleep is the most important time for detoxing, healing, repairing. Because I know lots of patients who spend like thousands of time, like time and money as well, like therapies, lots of therapies. And the first question we ask, like, how's your sleeping? Oh, I don't sleep well. I don't like, that's the time we heal. That's the time we really need to repair ourselves and detox as well. So sleeping well, having like evaluating the airway, it's a must in a holistic office or biological office. And like symptoms, I will say like symptoms like grinding your teeth at night, that's a sign of narrow airway, especially for children as well. Like it's for adults and children. If grinding, snoring, narrow arches, like high palate, you can see the roof of your mouth really deep up there. And fatigue, cranky child, and bedwetting, it's a sign of narrow airway. So, and oftentimes, sleep disorder are misdiagnosed as ADHD or other behavior concern. So imagine if you don't sleep, that kid or that child doesn't sleep every single night because they have an issue with their airway, narrow airway. Like the behavior definitely will be affected as well and being a lot misdiagnosed as being ADHD. All right, so we treat children here for if we have any of these symptoms with myofunctional therapy, which is non-invasive at all, and just a couple exercises, maybe an appliance at night to wear, what we call like myobrace, which is directing our muscles, directing like to grow and grow the jaw and jaw development to open the airway and expand the arches. As you can see here, we were treating like snoring for this child. And we were doing the exercises, we were doing an appliance, and it's on, you can see the crowding before, and that's after, without even aiming to fix that crowding, because it's just expanding, growing the arch on its own, though, who is doing these exercises. And this is a child, you can see how you're barely able to see his lower teeth here. When he bites down, you see only the upper teeth, you're not showing anything at the bottom. And you can see how narrow his arch. It's pretty narrow. I'm talking here after a few weeks of these exercises, the arch is so wide, and you can see most of his lower teeth. That's a child, it was like bedwetting, snoring, grinding at night, and you can see the wear facets on his teeth. And when they came, it was a big tongue tie. And once this tongue tie clipped, and you can see the crowding, actually there is no space for these two, because our tongue is our natural expander. If that tongue tied, it's not going to expand our arches. And we're going to have a problem with the airway as well. Exercises and appliance as well, at night only. And look how big difference it is. You can see the big difference between before and after. So the main goal for the myofunctional therapy is nasal breathing, which is really important, especially at nighttime. You know, when we sleep and breathe through our nose, our body, okay, so we are on that mood, rest and digest. So we're sleeping, we're calming, we're detoxing, healing, repairing. If you're breathing through your mouth at night, we breathe through our mouth when we run from a lion, we're like kind of like stressed out. So at night, if you sleep, opening your mouth, your brain, okay, I'm healing, repairing, or I'm just like, I'm fighting. So you don't get enough sleep as well. So we're aiming to myofunctional therapy to have that nasal breathing, proper tongue position, proper swallowing pattern, and proper lip seal as well. For adults, we use aligners for expansions. We can use expanders as well, but most of the time, if it's like we can expand the arches to open the airway a little bit, that's what we do. And it's really important when we align the teeth as well with like Invisalign or Sure Smile, because sometimes we retract, like most of the time, like orthodontists or other dentists, they can retract the teeth, actually creating less room for our tongue, making our airway narrower too. And if you have a child or you know a child like being recommended to extract the premolars to bring the teeth back, that child will suffer for the rest of their life because of we retracting there. So retracting their arches back and making the airway really narrow. So we aim to align teeth with aligners in our office or in biological offices, and as well as making sure we don't restrict the airway as well. So we fix the bite, we expand, and we align at the same time. I'm going to talk about dental products. That's the final thing, which is like lots of toothpaste, like which toothpaste should I use, or like fluoride. This chart can tell you like fluoride, excessive fluoride can lead to cardiac failure, can have diabetes, cognitive deficits, lower IQ for children, can affect your thyroid, iodine deficiency, lower fertility rate, myocardial damage with heart, and cancer of the bone. It's toxin. according to IOMT, and it is a toxin. And if the child swallows some of it, you have to call that like the toxin department, so you make sure like it doesn't get affected. So it's important like not to use, or like we're aiming to avoid fluoride in our toothpaste and our products as well. And some toothpaste, they have triclosan, even though it's banned, but it's still toothpaste. And that can lead to breast cancer, and it does interfere with the endocrine disruption. So we really recommend something that has hydroxyapatite. Again, hydroxyapatite, it's like a crystal between calcium and phosphate. And our enamel made from that crystal, our bone, most of it made of this crystal. So it's pretty natural, pretty safe. And by studies, it works better than fluoride, remineralizing your teeth and preventing sensitivity as well. So we prefer like something called nanohydroxyapatite, which is even better than in remineralizing your teeth, help with sensitivity better than any fluoride by studies, and remove plaque and naturally whitening your teeth as well. And it's pretty natural. And I prefer, you can use something called Boca. You can get online as well. Risewell has hydroxyapatite. I prefer something personally called Dr. Jen, Jen, which has the right amount, which is like 10% of tooth hydroxyapatite that will prevent cavities, will prevent like remineralizing. If you have sensitive teeth, all you need just toothpaste that has hydroxyapatite. And hydroxyapatite, it's different from fluoride toothpaste. When we brush, we have to rinse fluoride toothpaste, but it's toxin. You don't want to keep it in your body. Hydroxyapatite, you brush and spit and keep the rest around your teeth to remineralize your teeth. And I think I am done. And again, like healthy smiles start with decision we make every day. And I'm done.
Thank you. That was excellent. I learned a lot. Awesome. Great. Thank you so much. Okay. Let me head over to our questions that were previously submitted. All right. So the first kind of a two-part question. The first part is if you have a root canal, if someone has a root canal, should that be removed or replaced? And if so, if you have that root canal removed and something put in, like an implant, how does that affect the meridian that it's attached to, or meridian?
Those are really good questions. So I'm going to answer it. So again, root canal, I mean, every tooth is an organ. Root canal is just removing the blood supply, the lymphatic supply, the nerve from the tooth, and just keep it as a dead tooth inside your body. Is it healthy? I don't think it is. And by studies, the maximum cleaning inside the tooth will be like the day you had the root canal or anybody had a root canal, the maximum will be like 60 to 70% of cleaning. So we're leaving some toxins, bacteria, hoping for your body to take care of it. So it's case by case. We do here something called 3D X-ray, which is the cone beam, and we evaluate the tooth. If there is infection, definitely we take the tooth out. We recommend taking the tooth out. If no infection, I will check the meridian chart if any other organ affected when we have this infection. And if no organ affected or no issues at all, I prefer personally like monitoring this tooth. But some biological dentistry, to be honest, I'm just telling you every single root canal has to come out, every single titanium implant has to come out. Personally, I will monitor if no infection from the cone beam. I will monitor and monitor the meridian too, the organs that is connected to the tooth. Metal implant, it does interfere with your electromagnetic field. It is. And before removing them, before going like changing them, I would love to have something called ELISA test to make sure you're not allergic to any component of this metal, and as well as looking at the meridian chart as well.
Okay, great. That made sense. Checking the chat for questions at this point. One is coming in. I think maybe we might have answered that one, but similar. Is the root canal better than removing the actual tooth? I was told the tooth is dead and should be removed, but my dentist said that a root canal would be best in order to save the
If we
tooth.
can avoid that, Jessica, because till this morning I had a patient who has like, yeah, a deep filling, a little bit deep filling. But the problem is once we see a deep cavity is like in traditional, okay, that's a root canal, and like, we test the tooth multiple times before like extracting the tooth. If we can prevent this tooth from getting the root canal, we will do by using biocompatible material. We're using ozone. We use sometimes laser that really help the nerve not to get irritated as well. So we use biocompatible material to avoid that inflammation. I will say like 90 to 95%, like most of the patient who've been referred for a root canal, we saved their tooth even without a root canal or extraction by using just biocompatible material.
Okay. Yes. Okay. I love that. Okay. So you mentioned excessive fluoride. What might be the optimal level to reduce fluoride to or stay below?
I will try to avoid. It's a toxin. If
Yeah.
we can avoid it, because most of these toothpaste as well, it does have lots of chemicals. That's why I like Dr. Jane one. If you can read the ingredients, it has like 5 ingredients. If you can read any other of this fluoride one, you will find like around 25 ingredients in it. Most of them harmful for you. So if we can avoid it, we will avoid it. Get a natural one to protect your teeth.
Okay. Okay, this one is about the tongue tie. Should the tongue tie be cut before you use aligners?
Yes, because we're gonna use our tongue as an expander as well. It's a good idea to remove it before the liners, but we will have lots of tongue exercises before and after too.
Got it. So
And
to
it
prepare for
does
that.
work hand in hand with chiropractor too for adjustments. So it's if it's for adults. For kids, usually it's easier. And we use it
Okay.
like we clip it with laser. So it's pretty simple, less painful, and it heals faster too, and less bleeding too.
Yeah, I was just thinking about that. It's probably less mess.
Yep.
Okay. How do you feel about dental pulling, coconut oil pulling?
I love it. So it really helps the microbiome. So balancing the microbiome and just make sure you do it like maybe for 10 minutes or so if you can. And don't spit on the sink. Always avoid, like it's gonna ruin your sink. And use that organic extra virgin oil, like coconut oil. It
Gotcha.
does help with the
Okay.
microbiome. And again, don't swallow in if you have mercury fillings, or don't swallow in because it pulls all the toxins from your gums, from your teeth. Don't swallow any of this oil when you do it.
Okay.
Make sure you get rid of it. Yeah.
Yeah, just for those who might not have heard of coconut oil pulling, just in a couple sentences, what exactly is that, and why would someone want to do that?
Mm-hmm.
Oh, yeah. Can you explain it a little bit
I'm
more?
sorry. Say it again. I'm sorry. I didn't hear you. I'm sorry.
That's okay. For those of us who may not know what coconut oil pulling
Yeah,
is,
yeah.
can
I'm
you
sorry.
just
I didn't
just
explain.
go
Yeah.
back and tell us what
You,
it is?
you
Okay.
can get from actually, I get mine from Costco. Extra extra virgin organic coconut oil. And take a tablespoon and just put it and keep swishing around your teeth until it's liquid and keep going, like pull between your teeth. Get all the toxins, get all the bad bacteria in between your teeth out and just spit it. Give it like 10 minutes or so, 10 to 15
Okay.
minutes. And
Once a
don't
day?
once a day and don't overdo it. So you can do it once a day, every 2 days, 3 days. So twice a week, 3 times a week.
Okay. Got it. Got it. Okay. And I had a question following that. It's refined or unrefined?
I'm sorry, where is
Is
it?
it refined or unrefined
Where
oil?
uh, Oh, you're talking about the coconut?
Yes.
I think unrefined one, but
Yes.
I'm not sure. I will get back to you with this one.
Okay, great. Um, okay, next question. Is there any activism surrounding dental insurance companies only covering metal fillings?
They're trying though, but I mean, it's still like most of the insurance, they cover metal fillings so far for posterior teeth. And yeah, hopefully one day it's getting better by better. Now I see most of insurance trying to avoid like getting a little bit better with the white fillings. And again, white fillings, it depends. It could be toxic as well, and it could be biocompatible. But I mean, like now some insurance getting a little bit better with the silver fillings, so they're trying to just cover as well for the back teeth white fillings. But most of them still covering the middle filling.
Okay. 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 Kind of coming around again to alignment work here. What's the best alignment device for aging teeth?
I'm best aligning device for aging teeth. Like you talking about Invisalign? What is the question? I'm sorry, I'm a little
Probably,
lost.
yeah, I think so. And
But we
maybe
use
Martha.
Invisalign in our office. That's why, and we use
Okay.
sometimes Sure Smile too, which is like the same.
Okay.
It does
Sure
work for
smile. Okay.
adults. Yeah, it does work for adults. It depends on compliance. If you wear it like 22 hours a day, it definitely does work. You wear it
Okay.
like 1 hour during the day, yeah, it wouldn't. So you know yourself better. If you're make sure you're aware, like you're compliant, it will work perfect.
Okay. Yeah, this is another kind of a similar kind of
We use
question
it a lot
regarding that.
here. Yeah, and we explain that arch as
Okay.
well with it, again to a
Okay.
certain limit too.
Okay. And those, they definitely will realign jaws if people stick with them, use them regularly, follow the protocols. I've seen it. I mean,
Me
I
too.
know
Yeah.
personally people who
Again, it
use
depends.
those.
Some,
Yeah.
yeah, it depends. Like most of the time, I will say, but if it's like skeletal things, so it's jaw or whatever,
Mm,
sometimes surgery is needed.
got it. Okay. Okay. So there can
So it
be a
has
limit to,
limitations. Yep.
yeah, has limitations to what they can do. Okay.
Mhm.
Um, let's talk about ozone therapy again. Um, there's lots of value in ozone therapies.
Mhm.
This one person has said just that her dentist poo-poos it all the time, so has a negative reaction to having it. Um, but there is a lot of research. Is that
Actually,
correct?
it definitely is. And again, like if we use it, like we use it for disinfecting, lots of research. If you want lots of research, we can email it to you. But I mean, ozone, it's pretty safe, first of all. As we mentioned, it targets only bad bacteria, pathogenic bacteria only. And it's effective as for disinfecting better than chlorine and faster than chlorine. It does help with dental sensitivity after fillings and crowns as well, because it seals distant tinal tubules as well. There's lots of study we can share with you.
Okay, great. So I have a question here. If someone lives in an area where there is no biological dentist nearby, what options would they have? I mean, perhaps there's some limits. Maybe telehealth might be too complicated to do, but is there something they could do on their own? How can they kind of
Again,
split the
brushing,
difference?
flossing every night, that's important. Brushing, flossing. Every 6 month cleaning, unless you have deep pockets, then you're gonna need every 3 months cleaning. And cleaning, I will say we're a little different for cleaning because we use ozone, we use probiotics as well. But I mean, you can do your cleaning with your doctor or in the area doctor. If you were told you need a root canal, I'm not sure what to say, but I mean, like, it's always a good idea to have a second opinion, root canal or like extraction.
Gotcha. Okay.
Because sometimes it's just a deep cavity. Once you use biocompatible material, you don't need anything else.
Okay. There's a question here. What is the thing with taking a glass of water and swallowing the bacteria in your mouth first thing to help with the gut? So I think that says first thing in the morning, take a glass of water and swallow bacteria in your mouth to help with your gut?
Again, our mouth is the gate health for our gut. It depends. If you have balanced bacteria, that's a good thing. If you don't have a balanced bacteria, so you're harming yourself. So it's always good to have balanced microbiome, which is I really recommend like taking oral probiotic. I like something called Super Teeth. You can get it online too. And it's only for the mouth bacteria too. So it really enhances the microbiome.
Okay. Thank you. What do you recommend for a simple toothache? And now I think in my mind, I think through a biological dentistry lens, that might be an indicator of something, downstream going
It
on.
could be if
So,
the tooth has nothing, you're absolutely right. If the tooth like perfect, like we did the cone beam or x-rays or whatever, the tooth has nothing, I think it's always good to look at the meridian chart and look at the organ. Sometimes it's just the meridian, and we see that a lot. If the tooth on the x-ray does have nothing, it's important. But again, sometimes the symptoms, okay, is it hurting cold, hot only, or cold only, hot only? Do you wake up with pain? So it's finding the root cause why you have the pain.
okay. Okay. So if the tooth is still feeling sensitive to cold or sensitive to hot, then there's some nerve that's still active. It's not in,
Yeah.
may or may not be infected, or it wouldn't be infected. And then you kind of move from there.
Yeah. So like if the tooth is feeling cold and hot, that means it's not infected. Because I had a
Okay.
patient this morning or yesterday actually. It was like, okay, my dentist prescribed me antibiotic. And I was like, why? The tooth is feeling hot and cold when I drink something. The nerve is still alive. So there is no infection yet. So you don't need that antibiotic yet. All right. We have an abscess, we have swelling. Definitely we do need it. But in his case, it wasn't needed at all. And if the tooth is cold and hot, actually sometimes with the ozone gas around that will help with the sensitivity, as well as hydroxyapatite toothpaste.
Okay. Okay. So cool. I had a question about the cone beam X-ray come in. How long does that X-ray take? And how does that work? What's the process for getting that
It just
accomplished?
takes 5 minutes. I mean, less than 5 minutes. And it shows me a lot. It's like everything. Like I go 3D around every single tooth and just make sure there's sometimes, and I can share with you later too, like pictures from the 2D dimension X-rays, like regular X-rays, and the tooth looking great, no issues. From the cone beam, a huge infection all the way to the sinus, and I will share with you so you will have an
Oh,
idea.
good.
So
Yeah.
3D
Okay.
dimension X-rays really shows me any hidden infection, any sinus inflammation, and most importantly, evaluating the airway. So if we have
Good.
a narrow airway, we have lots of options how we deal with the narrow airway. And again, if you have narrow airway, you have symptoms too. Grinding is not normal because now everyone is grinding. That's not, everyone is not normal though. So there is an issue. Snoring is not normal. I mean, snoring when we have cold, yeah, it's understandable. But every single night we're snoring, that's not right. Breathing through our mouth, not our nose, is not a normal. So there's lots of signs and symptoms to have a
Okay.
narrow airway.
That's very helpful.
Mhm.
I do have I've been known to grind my teeth.
Mhm.
So also, I'm curious about how a teeth cleaning, regular teeth cleaning. So let's say I want to go and see a biological dentist, and is the same protocol? Is it the same for a biological dentist to get your teeth cleaned every 6 months like it is at my
It is the
traditional
same
dentist?
protocol of the timing
Yeah.
wise. We're talking. If you have deep
Okay.
pockets or like periodontal or gum issues, you need it every 3 months instead of 6 months.
Oh,
But
okay.
we use ozone water only. So in the unit, the water coming to your mouth is not a tap water that has full of like toxins and fungal. So it's like pretty clean water you're getting when we have the cleaning because it's ozonated water. And we use probiotics as well as ozone gas around every single tooth for the deep pockets to kind of disinfect these bad bacteria.
Okay.
So it's the same timing process, but a little different. And we take a little longer time, so we make sure spend more time cleaning too.
Yes, yes.
Yeah.
I can say from experience, it's gentler. It's much gentler. And it's yeah, less invasive. It didn't feel
Yeah, I'm
as
glad.
loud and noisy.
Yes, yes.
Okay. Um, that's great. So I have a question as well. So if someone like myself again had mercury fillings removed maybe 4 or 5 years ago that at a dentist that was not a smart removal, is there anything I should be thinking of or worried about?
I think we like it's a good idea to test. You can have like hair analysis, can tells you if there is mercury fillings. I prefer something called Vibrant Lab. Vibrant Lab, it's a urine test that tells you if you have any heavy metal, including mercury toxicity, or if you have environmental toxicity, or like any mold toxicity. That's why we prefer to do the Vibrant Lab. But
Vibrant. Okay.
Vibrant Lab, yeah. So
Okay.
we do that test to make sure it's called total burden toxicity test. So it tells you if you are exposed to any of those. And actually, like we did it for my nephew, and he's a 5 years old, being diagnosed by Hashimoto's, and we are so holistic, like eating healthy. We don't eat, and like we're really holistic. And we did that test to make sure like how like we are exposed to many glyphosate, PPA, even though we don't eat in plastic. So we get some no matter what. That's why the question about fluoride, like how much it should be, it's all good to avoid any toxin because we are already getting exposed to toxin, even though we're trying to avoid it.
Okay. Thank you.
Thank you.
Okay, how are we doing on time? 12:52. Okay. One other question I have for you about the
Sure.
experience of going to a biological dentist versus a traditional dentist is the intake process. So the questionnaire we may need to fill out. What is that? How does that look?
Yeah, and like in any other different office, so this is like medical dental history. Actually, in our office, we're looking for total toxicity, like how much toxins you're exposed to. We're looking, of course, in details in the medical history. If you're taking supplements or you're not taking supplements, and if you're aware of vitamin D levels as well. And we do diagnostics the first visit. So it's kind of the cone beam and exam evaluating the gum. And we have review of findings in another Zoom session or in-person session. So we're going to go through everything we figured and we discuss recommendation, treatment plan or recommendations together.
Okay. Um, and in order for someone to find a biological dentist where they live, where do you suggest they go?
Either IOMT or IABTM.
Okay. BTM. I'll drop that into the chat
Yes.
there.
Mm-hmm.
Okay. Okay, I'll get that sorted out. Oh, here's another question. Does Blue Cross Blue Shield, I believe, typically accept biological dentistry?
I feel like it's the opposite though. Like I feel like biological dentistry, they don't kind of accept or like getting insurances because like insurance dictate what you're doing. So we're not getting insurance, but we can submit what we do to your insurance, and it depends how much we cover out of network
Mm-hmm.
coverage. So we can have pre-authorization for your dental work needed, send it to your insurance. They're gonna tell you exactly it's gonna cost whatever. They're going to reimburse you for being out of network, doing the work with out of network dentist that much.
Okay. Yes, it's kind of a process, but you can go to a biological dentist's office and use that information to go and then submit to your provider.
Yes, you can.
Yeah, yeah, and yeah. Okay. Um, Anything else coming in? Anybody have any final questions for Dr. Elhamamsy? No? Okay, so
Good.
what I'm going to do is I'm going to send tomorrow or the next day or so kind of the remainder of the things that we talked about, the recording, the transcript, and get that sent out to everybody, and some slides so they can go back and look at those if they want to. And to let everybody know that Chris put the link to the next month's BioBytes in our chat. So that's there too. And I think that's all I have on my end. Thank you.
Thank you for attending, though. Thank you.
Yeah, that was great. So I'm going to stop the recording at this point,